thank you, Wendell, for a great presentation and for staying under budget here. I'm just acting as Dean Rosen's time guarantor here. So, next up, with what I think will be a somewhat contrary opinion, is just saying, Joe Antos, who's the Wilson H. Taylor Scholar in Healthcare and Retirement Policy at the American Enterprise Institute. And for those of you who've been here before, Joe is both a fixture at this conference, and he draws on a wealth of experience in government, at the agencies, in the White House, at CBO, and now at AEI. Joe.
Thanks, Murray, and thanks, Wendell, for that great presentation. You know, I was really excited about Wendell's presentation, or at least the first minute, because he said he might as well sit down. Why did he stay up? Right now, honestly, I don't know how to change the slides. Where
Let a Democrat show you.
Yeah. Oh, it's because Murray had it. You know, it's those HMOs. They're controlling. Okay. All right. Well, so, you know, apparently it's time to make health reform great again. The way I look at this is that Democrats have been working on health reform for the last 25 years. And Republicans certainly should have the opportunity to endure the same misery the Democrats have endured over that same time period. You know, this is the swamp. And you know, when you drain the swamp, well, you get a mess. So that's something that we're going to be facing for a while. But you know, there might be a better way. On the other hand, is all right. Okay. All right. So now we're going to talk a little bit about alternative facts. But you know, I could have put my photo there, but I figured you already know what I look like. So. But not alternative reality. So clearly, there's a lot of denial on both sides of the aisle. It still seems to come as a surprise to some people on the left that Republicans really did win the election, not just the presidential election, but the House and the Senate as well. It is certainly the case that many Republicans agree with many of the objectives of the ACA, not necessarily the way the ACA went about it. And even better, many Republicans even agree with many Republican proposals. But I think the ACA does not live up to the hype. Here's the alternative picture. These are actual statistics rather than statements that characterize actual statistics. And the ACA had something to do with it, but as I remember the point of the ACA, it was to expand coverage. That was the principal goal. And so if you're expanding coverage by providing more subsidies for that coverage, then at least initially you wouldn't expect a big improvement there. And in fact, most of the decline in the rate of growth of overall health spending really occurred before the Obama administration came into office. So I think, you know, I think we could argue about that, but it's hard to disagree with this picture. I mean, it does say how important the overall economy is to everything we do in healthcare, and that was, I think, the major point of the talks from the first panel. Certainly, the exchanges haven't been a great triumph in terms of enrolling people. You can see what's happened, and I did a version of this slide last year, and you can see CBO's original estimates assumed much greater enrollment growth than actually occurred. Now, I'm a graduate of the Congressional Budget Office, and so CBO's estimates, are, of course, are projections. The projections that they made in 2010 were clearly wrong, but they did tell you where the savings figures came from that Wendell cited. Wendell cited CBO long-term savings figures, but those savings figures were predicated on the belief that everything was going to go great with the ACA and you were going to get this kind of enrollment instead of the actual enrollment that we actually saw. It also assumed the kinds of savings that really haven't materialized yet. Yes, there were some savings, but in fact, when you're looking at projections, especially old projections, what you're looking at is really a set of assumptions that may or may not have been valid 7 years ago, but are certainly not valid today, and don't tell you much about what's going to happen in the future. There was a little bit of disturbance in the ether here because the Trump administration, I thought oddly, decided not to run some ads on television that they already paid for. This lasted about a day or two when somebody said, hey, wait a minute, we paid for those ads, we might as well run them. Charles Gaba, who is really a fine analyst of insurance trends, characterizes that as Trump sabotage. And in a sense, it was Trump sabotage. I'll say why in just a second. But he says, shockingly, it reduced exchange enrollment by 6%. 6% seems like a pretty big number unless you look at what 6% is. Well, it would have been 12.9 million people instead of 12.6. So this is not exactly a major impact. However, it did do some wrong things for Republicans. First of all, why wouldn't you want to encourage more people to sign up on the exchanges? Because the people who were going to sign up anyway were the people who were the more costly enrollees. So actually that advertising would have made sense in any administration, at least for the duration of the exchange subsidies and so on, which is certainly going to be the case for at least a year, but I think probably longer than that. You do want to have younger, healthier people go in. That didn't happen, and so but cutting off the ads really didn't make any sense at all. Now, the fact is that Medicaid is really the driver of coverage increases for the ACA. And as John Gruber, who I think is the person that Wendell was referring to, the MIT professor, as John Gruber said in a paper recently, much of that Medicaid expansion was people who were already eligible for Medicaid and didn't sign up. Now, this is a rather puzzling result because a lot of people sign up for Medicaid by getting sick or at least having some incident and going to the emergency room, and the hospital enrolls them because the hospital wants to get paid something, otherwise they won't see any money. So it's a little puzzling about this woodwork effect, but the fact is that it's really the advertising, not so much the change in the rules about Medicaid, or not, and certainly not so much about the increase in payments, because of course the people who are already eligible were not bringing in 100% payments. They're bringing in whatever the state match was, 50% in California, up to about 75% in, I think, maybe Mississippi or a state like that. So in fact, a lot of this enrollment was people who were already eligible and could have been signed up virtually at any time. Okay, now, another thing that will work possibly in Republicans' favor, but it's something that people ought to be aware of, and that is that it is absolutely true. I agree with Wendell. I agree with anybody who says that the ACA had a very positive effect on increasing enrollment in health insurance. It certainly increased enrollment in the individual market because of the subsidies, and in Medicaid because people got shunted to Medicaid if they were eligible for Medicaid instead of the exchange market, and also some people enrolled in their employer's plan because they had the mistaken idea that there would be something really terrible that might happen to them if they didn't, and those people might well drop out if the mandate goes away, but it's a little hard to say. But the key thing here is that most people in this country who are sort of not insured right now have access to insurance in the sense that they are either already eligible or they could afford, arguably they could afford to pay for it. Now, what about undocumented immigrants? The ACA specifically excluded undocumented immigrants from the subsidies. That was a policy decision made by the Obama administration. You can argue about whether that was a good idea or not, but that was a decision made by the Obama administration. So they're the ones who are really, in some sense, out of luck if health insurance is what really matters here. The only other people who are really out of luck are U.S. citizens who aren't eligible for any of these other things. They're in the coverage gap, and basically these are people who are by and large, they may be from Texas. They're by and large in states where the state didn't expand their Medicaid program. That's where the coverage gap is, and that is an issue. Okay, now, let me get on to the more relevant part of my talk, which is what's wrong with the ACA, at least as far as Republicans are concerned, and what do they plan to do about it. It is absolutely the case that ACA rules destabilize the individual market, the non-group market. Prior to the ACA, the non-group market was stable. You didn't necessarily like the results of that stability, but you can't deny that it was stable. I would argue that guaranteed issue is a good social policy, but nobody can deny, again, that risk selection is inevitable. And if you're going to guarantee coverage and you're not going to have any limitations on benefits, then somebody's going to have to come up with the money. So the story is about money. It's not really about enrollment. The story is really about money. In any event, many of the ACA policies made what was inherently going to be an unstable situation worse. The mandate was weak. The penalty, nobody was penalized in 2014 because you had to fill out a tax form. So if there was going to be a penalty, it was going to occur in 2015 at the earliest, except that what you really needed was to have people believe that there could be a penalty right away. And a lot of people don't necessarily watch the news on television. They don't pay much attention to government press releases and so on. And a lot of people, especially in the lower income, uninsured market, basically would check with their neighbors. Well, gee, is there any, what should I do? And the answer generally in 2014 would be, gee, I don't know. Well, you could buy insurance, but there's not necessarily a negative there. We don't really know about that. And so it started off very weakly, and it's maintained its very weak penalties, and it doesn't have a positive to it either. One of the problems with the subsidies and the exchanges is that people don't actually see any money. So the money goes to the insurance companies. Now, that's efficient from an administrative standpoint, but people don't necessarily value insurance the same way in this market, the same way that middle-class people who are being subsidized through the tax system because of employer coverage, they may have different views about how health insurance works for them. And so because of the subsidy, they said they're getting a subsidy, but they don't know what the price of insurance is. So they don't necessarily see that there's a very strong positive to getting this subsidy and buying insurance. But what they do see is that there's a premium associated with it, and they do see that if they get that far, that there's a deductible and it's pretty sizable, and then they begin to ask themselves, well, gee, is this really buying me anything that I want? Other problems, the under 26 provision is a real issue here. This is the largest group of healthy people in society, and most of them are staying with their parents' plan. And in fact, these are actually the best risks in the entire insurance market for another reason. Because as I said, money is what matters here. And so middle-class parents probably were going to pay for their insurance anyway. They may, who knows? I mean, if they're living in your basement, you might as well pay for their health insurance, right? So that's the right kind of customer for an insurance company. Somebody who's healthy and somebody's paying their premium. Well, they're out of that market largely. Community rating is an issue. Age rating, loose enrollment rules. That in particular has been an issue. With these special enrollment periods that basically you're supposed to have a change in life, and if you do, you can get coverage with no penalties whatsoever. But there really hasn't been much enforcement about what constitutes a change in life, or what evidence do you have that anything really changed. The 3-month grace period is another issue. In most states, virtually all states, it's been 1 month. The 3-month period basically has encouraged people to sign up, not pay their premiums, get their problem solved, drop out, and then next year repeat, rinse and repeat as often as possible. 10 minutes. Okay, Murray, well, we'll see. We'll see if I'll get there. I'm willing to, by the way, I told Murray that I'd be willing to forego actual substance for jokes, so we'll see. Okay, so as a result, what did we see? Sharp increase in premiums. Now, I have a comment about this. One is, I think that the increase in premiums is actually a correction. I don't think it's a bad thing. I think it's inevitable. The overall risk pool in the exchange market is not a desirable risk pool. It's absolutely the case that insurers had no idea what they were getting into in 2014. They weren't too sure in 2015. But this is the 2017 plan year is the first time they actually had good, solid evidence that their actuaries could use to set their premium proposals. And it's not a surprise that it went up, because the conditions in that market just were not what these companies were expecting. In addition, a lot of the insurers, I think maybe this is my next slide. Well, it might be. A lot of the insurers were really not involved in the individual market in the first place. So they weren't really involved there. They were more used to providing administrative services to large employers, which is a different kind of a market altogether, with different financial incentives and different pressures. This is a very different kind of a market. It's closer to Medicaid than it is to the employer market. And I think that wasn't as appreciated as it could be. But I think a lot of this increase was inevitable, not just because plans came in low to try to get market share, that makes sense, but because essentially what we set up here is a system where you either have to find a way to tax middle and higher income taxpayers to pay for much higher costs than you ever thought was going to occur in the health insurance system, or you're going to have to bury those costs by having insurers raise rates somewhere else. And there are limits to how far you go in either one of those directions. But eventually we're going to have to deal with a reality. Now, one other thing that Wendell said, and Democrats say this all the time, well, you know, people really weren't hurt by the increase in premiums because, of course, the subsidies went up, basically in line with the increase in premiums. And that's pretty much true. But that leaves out the fact that somebody picked up the cost, and who would that be? Well, that would be taxpayers. So in fact, if you look at the actual cost of the program, not CBO's projections based on a misunderstanding of how things would work out, and an inevitable lack of knowledge anyway that all forecasters have, they don't know perfectly what's going to happen, certainly over a 4 or 5 year period, much less over 10, much less over 20 or 30, as Wendell was pointing to. You know, the problem is that we do have a very expensive program, and taxpayers are picking up the tab. In addition to this issue with, as I said here, where the big insurers really didn't know what they were getting into, clearly in 2017, we saw a big dropout in large insurer participation. Again, it's not surprising. These big insurers in particular were really not in this market. So going into that market, you know, you'd ask, well, why did they go into the market? Well, you might say that it had something to do with politics. Maybe, I don't know.
Nothing to do with politics, everything to do with the profits.
Maybe. I know that's what you're going to say tomorrow, Cheryl. But the reality is that they're pretty smart. They know how to run businesses. They make a lot of money outside of the individual market. They didn't make much money in many of the local exchange markets, which is the reason they're dropping out. Now, I would argue again that that's a corrective action. They shouldn't have probably been in those markets. They stayed in the markets where they thought there was a chance maybe they could make it work. But they went into a lot of local markets where it wasn't going to work. I'm guessing that their analysts probably knew this, but it was a political decision to go in because, after all, the anticipation was that they were going to have to live with this system for a long, long time. And I think that may well be true. We'll see. Anyway, what are Republican objectives? Well, these are sort of vague principles. These are not specific policies. The point here is that we don't know what the specific policies are. So when you see estimates from CBO saying they're going to be 28 million people who are going to be lose coverage if there's a repeal bill, that assumes a repeal bill that we haven't seen yet. It assumes a repeal bill that didn't exist last year. It assumes a repeal bill that doesn't exist this year. We'll have to see what repeal means. We'll have to see what replace means. But Republican objectives, what are they? Well, generally, and it's a political statement, we want to shift control to families and states away from the federal government. We want to slow the growth of health spending. Everybody says that, nobody does it. We want to give families more choices of plans. We want to ensure that everyone has access to coverage. We want to reform Medicaid. We want to reform Medicare, except we're not so sure about reforming Medicare anymore. But the most important thing is we want to repeal Obamacare. So repealing Obamacare, if we change the language, that's going to be very important here, and it would be great if Democrats would cooperate in that effort. In any event, Republican problem right off the bat. The ACA created a very unstable non-group market, and now here Republicans have volunteered that they're going to resuscitate the non-group market. They're going to have to go back on some of the policies that they have supported when they were not in power, because now that they're in power, those policies don't work very well. So there was a proposed rule out on the 15th that did a few things. I won't go into the details. I think this was more a signaling proposal to tell insurers we have plans to make the individual market a more of a business opportunity than a charitable, than a government-driven charitable requirement on your part. But it really didn't do an awful lot. The people I talked to in Washington are very excited about this, and when I say, gee, that didn't do much, they say, oh no, it did a lot. It was signaling. Republicans' problems more immediately have to do with money, because that's where it's at. So we have two big problems. The ACA requires insurers to provide substantial subsidies related to income for people under 250% of the federal poverty line for their cost-sharing requirements. And there are also reinsurance payments, and there's a $10 billion figure there that was supposed to be sent to the Treasury to buy down some of the debt. The cost-sharing subsidy money was not appropriated. The requirement was put into law, but they didn't put the language in there to put the money in. The Obama administration paid the money. They argued that, well, that's what we really meant. A federal court seemed to have sided last year on the side that Republicans were taking last year. But the fact is that unless this very large amount of money shows back up in the paychecks to insurers, they're going to conclude correctly that the individual market will not be the one they want to be in next year. And if you don't have insurers in that market, you're going to have a hard time giving people more choices of plans. So this is going to be a real problem for Republicans. I think they'll find a way of, I don't want to call it hypocrisy, but they'll find a way of getting around this. Now, how do you promote a balanced risk pool? These are some of the ideas that Republicans talk about. Continuous coverage protection, automatic enrollment. These are the two big ideas that Republicans talk about. It's a complicated area here. Basically, I think as a philosophical matter, they want people they want the principle in this country to be that you are covered unless you take an action to drop coverage, as opposed to what we've had since the beginning of health insurance, which is that unless you take an action, you don't have insurance. If you have continuous coverage protection, then this is also a way to make sure that everybody has something like a catastrophic plan. Insurers would would be able to access the subsidies for those people who are subsidized in the individual market, and that would help stabilize, if this could get off the ground, that would help stabilize that market. In addition, the idea of automatic enrollment is floating around. This is something that's a little bit more difficult, but again, the idea is that if you don't take an action, that you're automatically enrolled. And you could get out of it, of course, if you really don't like insurance, but most people, the idea behind this would be that people generally don't like to make changes, and so if they're automatically enrolled, they'll probably go along with it, most of them. Subsidies for everybody in the non-group market. Wrapping up in just a second. And let me just mention one big thing here, and then I'll move on past a few substantive slides to a few jokes. The problem with giving everybody an age-related subsidy is that low-income people, very low-income people, won't be able to buy insurance. And if they're not eligible for Medicaid, then Republicans will be, theoretically at least, passing a bill that says that they're throwing off, well, not 28 million people, but maybe 10 or 12 million people off of insurance. And that's not a good thing to run against. If you're running for re-election, everybody in the House is running for re-election in 2 years, and a lot of Republicans, a third, I'm not sure what the count is, but a fair number of Republicans are running for re-election in the Senate in 2 years as well. This is not something you want to run against. So this is going to be a real problem. My guess is that there may be some kind of a supplementary subsidy of some sort that will take care of that issue. CBO will certainly drive it home that they're going to have a big problem there. And then while we're at it, there are a whole bunch of other minor little issues the Republicans are saying they want to take on, and we can talk about that later on. I'm just going to skip these two. Well, maybe go back to Medicaid. Block grant, per capita allotment. I don't see it happening for the reasons that Wendell said, but what I do see is more state waivers, and perhaps a block grant idea might be something, along with some other changes that some states might actually be willing to volunteer for. Okay, so now the question is, who's in charge? This is what everybody in Washington wants to know. I get calls on a daily basis. Who do you know? Who do you know? Who do you know? Well, hard to say. Who's in charge? Well, might be Paul Ryan. That's a possibility. Might be McConnell. He obviously isn't sure either. Might be Dr. Price. He's now running the Department of Health and Human Services, although, he's part of the process, and he's a good part of the process. But, it might be other people. We're not really sure. Maybe. But no, these are all just jokes. Obviously, this is the man who's going to be making ultimately the decisions, right? Or maybe this guy, because after all, he's going to be making decisions related to what already exists. And a lot of those things really aren't going to change very much, or they're going to change in ways that are going to be very difficult to pull off. So in fact, I think he probably, at least initially, has the deciding vote. We'll see how it goes. Thank you.